Hi, my name is Noah Blevins, and I'm in NURB 361, or Intro to Nursing Research course. This is our critical appraisal of a qualitative study video. The qualitative study that I chose was Choosing Nursing as a Career, a Qualitative Study. To answer question number 1, what type of qualitative study was conducted? I believe that this was an exploratory descriptive study, as this study is trying to describe a situation. The situation that they are looking at is why students chose nursing as their career path. It's also stated in the methodology in the beginning of the report that they chose a descriptive design for this study. To answer question number 2, what type of data collection was used? They used focus groups to collect their data. They used 2 focus groups that contained 14 and 9 students respectively. They started with a very broad, generalized question to start the discussion, and then they used probes to promote further discussion and elicit more specific responses to look at specific influences. These focus groups were led by a moderator. They lasted about 55 to 60 minutes, and they were recorded at the students' discretions. Field notes were taken by the moderator over key points that were brought up during their discussion. They chose to do focus groups because past research has shown that focus groups are very effective in college-age students, as it makes them feel that they can express their opinions without judgment. To answer question number 3, discuss the analysis. The analysis of the data was done by coding. They used a specific computer program to code the data. They first transcripted the recordings verbatim and then plugged it into the computer program, which looked for similarities and differences between the 2 codes. And similarities and differences were pulled out by the program and then were analyzed by one researcher. The emergent data showed that there were a lot of similarities, but also a lot of differences in the 2 discussions. And then the data was then combed over for quotes to be exemplary statements for their influences. And then the data was then verified by the other researchers that were helping conduct the study. To answer question number 4, interpret the findings. In my opinion, there are many different reasons based on this study why people join the nursing profession. It seems as if the most significant is they wanted a job where they could care for others. Almost every student in the study stated that they liked nursing because they could care for people, and they wanted to do something that was meaningful with their career. They also mentioned job security a lot. Both groups mentioned job security as a large part of why they also chose the career. But the biggest outside influences on what pushed them towards being a nurse was a family member or friend that was already in the profession that had recommended them to join the profession as well. And also in the study, they also determined that social media isn't as big of an influence as previous research has showed. It didn't influence their decisions a lot, and their gender also did not influence it in a super impactful way. A couple of the males in the study had said that they didn't feel necessarily discouraged, and that it actually kind of inspired them to join the field, as it's a female-dominated field, or at least it's viewed that way to society. And so, in my opinion, there's just many different reasons as to why people join the nursing profession, but it seems that, according to the data, that it is most significantly because they wanted a job where they could care for people. Thank you.